Hello, my name is Dr. Carrie Jones, Medical Director for Precision Analytical, creators of the Dutch test. This webinar is going to be about cortisol. Is your low morning cortisol increasing your autoimmune risk? Let's dive in. Our objectives for this are to really understand autoimmune facts because autoimmunity is on the rise, and to understand specifically how cortisol plays a role in autoimmunity. And we're going to talk about a case at the end to really help emphasize this. So, autoimmune facts. Autoimmunity is affecting about 8% of the population. And unfortunately, 78% of those are women. A big autoimmune organization, the AARDA, states that there are over 100 autoimmune diseases, whereas the NIH, the National Institutes for Health, says there are over 80. Either way, 80 or 100 plus, it's a lot of autoimmune, and many more probably to be discovered. Treating autoimmunity is a multi-billion-dollar healthcare industry each and every year. And you know this. You have a lot of autoimmunity that walks through your clinic, talks to you in telemedicine. You might even be dealing with autoimmunity yourself. And according to the NIH specifically, the Intramural Research Program of the National Institute of Environmental Health Sciences, they say autoimmunity is on the rise. And we know that as practitioners. When it comes to autoimmune disease, autoimmunity is either Th1, which is T cell mediated, which is what we're going to talk about with cortisol, or Th2, which is B cell mediated. While I've said earlier that with autoimmunity, we're going to specifically focus on cortisol, please know that there are a lot that risk factors that go into autoimmunity. Everything from other hormones to environmental to genetics, but we are just going to focus on cortisol today. So let's talk about cortisol. Cortisol signaling starts in the brain. The hypothalamus releases CRH, corticotrophin releasing hormone, which then goes to the pituitary to release ACTH. And then ACTH goes down to the adrenal glands and tells the adrenal glands, specifically the mitochondria of the zona fasciculata, to start producing cortisol. Now, if you need a little graphical, here we go. We have our HPA axis, the hypothalamic pituitary adrenal axis. So the brain releases CRH, tells the pituitary to release ACTH, and goes down to the adrenals. Now you will see on here norepinephrine and epinephrine. ACTH does not release norepinephrine and epinephrine, but it does help in its production. When we zoom way in on the adrenal gland, you will see the adrenal cortex, which is the biggest part. And in the adrenal cortex, that's where we get the three layers. The zona glomerulosa, which is aldosterone, the fasciculata, which is cortisol, which is what we're going to focus on, and the reticularis, where you get your DHEA and DHEAS. And of course, we can't forget about the medulla, which is where we get our catecholamines, norepinephrine and epinephrine. But going back to our mitochondria, going back to the zona fasciculata, it's important to know that your cortisol production starts and ends in the mitochondria. Therefore, mitochondrial health is really pretty critical when it comes to addressing the adrenals and cortisol production. So cholesterol gets pulled in and it becomes pregnenolone. Pregnenolone then leaves, goes out to the endoplasmic reticulum, becomes 11-deoxycortisol, which comes back inside to the mitochondria, finishes out as cortisol, and then goes out into circulation. So if you're hearing a lot lately about mitochondrial health and cortisol, this is why, because cortisol production starts and ends right here. When it comes to cortisol release, of course, we know it releases in a circadian rhythm, meaning it's high in the morning and it's low at night. I always say that cortisol follows the sun and melatonin follows the moon. Specifically in the morning, though, it's known as the cortisol awakening response, or the CAR. And it's the health of your CAR on waking that gives us a lot of information. Before we dive into that, though, let's talk about testing, because not just any test will pick up the cortisol awakening response or really understand that diurnal rhythm that cortisol has throughout the day. Testing cortisol is really important. This is where Dutch comes into play. So Dutch looks at a lot of hormones, but again, we're primarily going to focus on cortisol. When you have options for cortisol, you can look at serum, you can look at saliva, and you can look at the dried urine test for comprehensive hormones, which is known as Dutch. Now, if we start in the center at serum, everyone's familiar with the blood draw. We know that we can use blood draws to test all sorts of hormones. But when we get a blood draw to look at cortisol, please know that's a total cortisol of what's in the blood at that moment, meaning it's a combination number of cortisol bound up to its binding globulins and what's free and active. So if you get a blood draw for cortisol in the morning and it's 10, you have no idea if that number 10 is 9 cortisols bound up to binding globulins and 1 free cortisol, or 9 free cortisols and 1 bound up to a binding globulin. And obviously it's the free cortisol that does all the heavy lifting. It's the free cortisol that binds to receptors and turns them on, does the stuff, right? That led to saliva, because saliva was easy to collect. You could do it throughout the day. That gave you your circadian rhythm. And salivary cortisol is free cortisol. And again, it's the free cortisol that does all the heavy lifting, binds to receptors and turns them on. Unfortunately, though, with saliva, you can't get other information such as metabolized cortisol. And not a lot of saliva companies are checking the inactive form, which is known as cortisone. So that led to the creation of Dutch, dried urine test for comprehensive hormones, where you can use the urinary aspect to get all your hormones, to get cool information like cortisone, metabolized cortisol, and get your rhythm throughout the day. And then you can combine it with saliva to specifically focus in on that cortisol awakening response. And that with the Dutch Plus, or that for Dutch is known as the Dutch Plus. So let's walk through quickly what it looks like when you're going to do your collection. First of all, when I say dried urine, not a lot of people know what that means. This is our collection device. This is what it looks like. So when you do a Dutch Complete or a Dutch Plus, you will urinate on these pieces of filter paper throughout the day. You'll do it first thing in the morning, a couple hours later, around dinner, before bed, and if you happen to have insomnia, you can collect it in the middle of the night when you wake up. Then along came the addition of saliva to add to it the cortisol awakening response. Now, you can choose from a saliva swab or a saliva tube, depending on the company. The problem with saliva tubes is that you have to passively drool or spit into the tube, which can take a lot of time. And when we're looking at the cortisol awakening response, time is of the essence, which I'll show you in just a second why, especially when it relates to figuring out autoimmune disease. Some companies do suggest that you rinse your mouth out with water prior to collection, and then you have to wait to resalivate your mouth before you can drool back into a tube. And unfortunately, that can cause too much time to go by and you miss the true cortisol awakening response. Then we have saliva swabs. Saliva swabs are exactly what you think. They're these like little cotton swabs that you pop into your mouth, get wet, and then put back into the tube. Because they're very rapid and because it's something you can do very quickly and easily, you get a truer CAR response. And in fact, it's so much better that this is what research uses. They use these Salivette swabs. Therefore, at Dutch, we use the Salivette swabs as well. We don't encourage or use or want you to passively drool into a tube. We want you to be able to just pop the cotton into your mouth, get it wet, stick it back to the tube because time is of the essence with a CAR. So the Dutch Plus is our combination test that does all of the urine markers in combination with the cortisol awakening response and cortisol through the rest of the day. So it's 4 dried urine samples so that you get things like your estrogen metabolism, your androgen metabolism, your progesterone, your organic acids, all of that comes in this. Plus, we add in the Salivette tubes or swabs so that you can collect your cortisol awakening response in the morning. So the collection is very specific. It's done in the morning, 30 minutes later, 30 minutes after that, around dinner and before bed. Plus, if you have insomnia, like I said, we do give the option that you can collect in the middle of the night, and then we can see what your cortisol is doing when you wake up at 2 in the morning or 3 in the morning. So by getting the urine samples in combination with the Salivette swabs, we get a really great picture of everything that's going on. With the cortisol awakening response, I did want to draw it out on how you collect and why this is important. The cortisol awakening response is really quick first thing in the morning. It is a natural response to when you open up your eyes and feel awake, or your alarm goes off, or you get awoken, I should say. So you collect as soon as your eyes open up. Pop the little Salivette swab in your mouth, get it wet, stick it back in the tube. 30 minutes later, you're going to do it again. 30 minutes after that, you're going to do it again. So it's waking 30-30. It's very quick. The fourth collection is around dinner. The fifth collection's at bed. And as I said, you can collect if you have insomnia. Why is this important? Why do we give you urine and saliva? Because we want to give you as many data points as possible. If you're working with somebody who has autoimmune, hormones are often always involved. So while the cortisol portion of it is very important, you still want to see what their estrogen is doing. You still want to see what their estrogen metabolism is doing. You still want to see what things like melatonin is doing, their testosterone, their B12 marker, methylmalonate, things like that. So by having as many data points as possible for your patient, you can really help to address what's going on with their autoimmune symptoms and the progression of their autoimmune disease. When you are assessing stress, this is the typical 4 points that you're probably used to. So they collect on waking, they collect a few hours later, they collect, in the afternoon around dinner, and they collect before bed. But as I said, the cortisol awakening response is different because it influences so many things when you kick off the day first thing in the morning. We really want to focus in, instead of a broad general cortisol look, we want to hyper focus in, because if you struggle with your cortisol awakening response, you're going to struggle with alertness. You're going to struggle with energy levels in the morning. You're going to struggle with stress response or your resilience, your level of feeling stressed out, blood sugar management. Remember, cortisol's main job is to deal with glucose. We talk about stress all the time, and we talk about energy as it relates to cortisol, but really, cortisol is a glucocorticosteroid. Gluco, because glucose is its primary job. So if your car is not very functional in the morning, you could struggle with blood sugar issues. Autoimmune development, which we're going to get into in just a second. Inflammation regulation. How many of your clients say to you, I wake up in pain? Wow, when I wake up in the morning, I'm so stiff, everything hurts. Your car can play a big role in this. Infection regulation. We know cortisol is anti-inflammatory to a point. Memory and recall, especially things you have learned today and recalling it the next day. If you were listening to this and the next day you're thinking, what was it that Dr. Carey said? You might have car issues. And of course, cancer outcomes. We know the slope of the cortisol curve can, depending what your slope is, can help or hurt cancer outcomes, especially when it comes to breast cancer. And there is even some research to show with prostate cancer. So we'd like to know what our cortisol curve is doing in our cancer patients. So how does the car work? Where does it come from? What in the body triggers it? So as you are getting closer to waking up, your pituitary is signaling ACTH production. And ACTH is going down to the adrenal gland and saying, hey, let's get up. Like now, can we get up now? And the adrenal glands have a blunting on them, on the receptors. And they're like, no, not yet, not yet, not yet. As soon as you open your eyes and you've registered that you're awake and light comes in, the blunting comes off, ACTH combined, and your cortisol shoots up. It's a natural increase in cortisol in the morning. This is why it's the awakening response, the car. That rise is very quick. Within about 30 to 45 minutes, it shoots up. Not hours later, not by lunchtime, but just 30 to 45 minutes later. This is why your timing of the collection of cortisol, if this is the component you are looking to test, is so important. Because if you miss the 30 to 45 minute mark and then the 60-minute mark or the waking mark, anywhere in there, you're going to miss the accuracy of what's really going on with your cortisol awakening response. Once you hit the peak of cortisol, it gradually starts to decline if it's normal. Not all people do that, and we have to help them. So the real question is, can you make a switch? Can you make the switch from I am conscious to I am alert? The real question that I ask every single person is, how long does it take you to feel alert in the morning? It's our cheater question to what's going on with your car. If you say it takes you like 2 hours and 2 cups of coffee to get going, I already know that you have a cortisol awakening response problem. Your car is likely flatlined or it's not spiking like it should because you need that oomph in the morning to get you going. Now, on the flip side, if you say, now, oh my gosh, I wake up in anxiety, I wake up with panic, I wake up 0 to 100 very quickly, then your cortisol awakening response is probably overshooting, overzealous, and we needed to help with calming it down and figuring out what the triggers are. What's triggering you to have such a response first thing in the morning? So ask the question, how long does it take you to feel alert and ready to go in the morning? It should only take you about 30 to 45 minutes. This is what the car looks like zoomed in on the cortisol. Now, you might think to yourself that it looks like a normal cortisol curve on other tests, but it's a zoomed in look. So this is again waking 30 30. This isn't waking in lunchtime. This isn't waking in 2 hours later. This isn't, just doing it at waking or randomly throughout the day. It's waking 30 30. So we zoom right in. When your patients say to you in the morning, I wake up with, that's when you really want to consider this test. In the morning, I wake up with autoimmune symptoms. In the morning, I wake up with panic and anxiety. In the morning, I wake up with pain. In the morning, I can't wake up. That's when you consider this test because we need to see what's going on right here on waking in the morning. So let's focus in on autoimmune. With autoimmune, I'm going to go back for a second because we're going to be looking at the thymus gland. Now, not thyroid, but thymus. That's right here behind your breastplate here. So with the thymus gland, your thymus gland is super cool and super smart and really important to your immune system. So there's a study, glucocorticoids are strong inducers of apoptosis in thymocytes. What does that even mean? Well, let's pretend you're a T cell. You're a T cell and you're a T cell in your thymus gland right now. So when you are first a T cell, you are what's called an immature double negative. So you're not a CD4 and you're not a CD8. You're kind of in this gray area hanging out. And so what you do as you mature, as you go through, T cell school, is that you then differentiate to become a CD4, CD8, but you can't be both. You can only be one. So you go from immature double negative, then you differentiate into a double positive, and now you have to pick one. Right? You've got to figure out which one you are. Unfortunately, though, we know apoptosis occurs all over the body, and most of your T cells don't even make it out of T cell school. They die. They go through apoptosis. The ones that do survive have to go through something called central tolerance. Now, central tolerance is where the thymus gland basically has every single piece of tissue in your whole body, and it runs those T cells across all of these pieces of tissue in your body to see if they react. They want to know, the thymus gland wants to know, do you react to any of your own self peptides? As an easy example, let's pick thyroid, right? So if you're going along, if you autoimmune react to thyroglobulin, then that's going to be a problem. And the T cells like, you fail. You basically fail because the thymus is like, you can't react to thyroglobulin. You can't react to thyroid. This is a big problem. I can't release autoimmune T cells out of T cell school. So what happens is if you pass, you become a single positive, which is a CD4 plus or a CD8. If you don't pass, if you have found that you are positive to a tissue such as thyroglobulin, the enzyme, then you have to be killed. I'm sorry, you have to go. So you fail out of T cell school and you have to undergo apoptosis. Now, how to trigger that apoptosis is the rise in cortisol in the morning. It's one of the big signals to the thymus gland to say, hey, all those little T cells that you've pulled aside that have failed, that are autoimmune, then cortisol spikes and the thymus gland activates apoptosis and they die. So the take-home message is if you have a low or a flat cortisol awakening response, if your cortisol is low in the morning, then those failed cells aren't killed. And as we know, cells are sneaky and they will just float themselves right out of the thymus gland and go into circulation. This means if you have reacted to thyroid and you now float yourself out of the thymus gland, you can now react to thyroid in the body. You could induce autoimmune Hashimoto's. You could worsen symptoms of Hashimoto's that you thought you had under control. It can go either way. So this is part of the reason with autoimmune that understanding your morning cortisol rise is so important. I gave thyroid as the example. It could be any of the tissues, anywhere in the joints, in the muscles, in the brain, anywhere. And so that's why it's important to know what cortisol is doing. So speaking of thyroid, let's look at a thyroid case. This is a woman in her 40s. These are her results. She had fatigue, especially in the morning. She's one of those people who said, in the morning, I cannot wake up. She required 2 to 4 cups of coffee to feel alert and ready. She has sleep apnea, but she doesn't use her sleep machine. She finds it, well, not sexy, is what she said. She uses a steroid allergy nasal spray in the morning sometimes, and she has Hashimoto's antibodies that have greatly increased recently, and she definitely feels more, quote, thyroid symptoms. So when we're looking at her cortisol awakening response, if we zoom in, remember I said this is supposed to be you go up to a point and then you come back down. She doesn't go up to a point, she flatlines. So she wakes up and then basically even kind of goes down a little before coming up a little and then going down for the rest of the day. So it's no wonder she needs 2 to 4 cups of coffee. She never gets that oomph in the morning. And it's no wonder she's feeling more hypothyroid symptoms, especially in the morning, or more autoimmune. So what can be happening? Well, we know that there's a negative feedback loop to the brain, which is with HPA downregulation. So it's possible she had high cortisol months ago, and now, because of the feedback loop, it's starting to decrease her cortisol. It could be poor HPA communication. She does, right, have sleep apnea, so it's possible her CRH and ACTH are not coming out of the brain like she should. She's not properly oxygenating the brain. It could be mitochondrial dysfunction. Low overall cortisol production occurs when the mitochondria aren't doing that well. Excessive amounts of psychological burnout, another big suppressor of the cortisol awakening response. Sleep deprivation in general. So I mentioned with sleep apnea that can affect HPA communication and oxygenation to the brain, but just sleep deprivation in general, because of her sleep apnea, because of snoring and disordered breathing, that can absolutely suppress what's happening with the cortisol awakening response. Now, she doesn't have this, but just as an aside, traumatic brain injury or any damage to the hypothalamus or the pituitary can also affect someone's cortisol awakening response. So with her, it's important to know that the hippocampus affects or controls the cortisol awakening response. And sleep apnea can really, really, really affect the hippocampus. Other things can too. Traumatic brain injury is an example, brain infection, brain inflammation, but sleep apnea I really want to point out. Chronic pain, inflammation, infection in general, anywhere in the body can downregulate the HPA axis over time. That feedback loop kicks in. PTSD, that's not acute, so post-traumatic stress disorder, doesn't apply to her, but as a general FYI, these are other things that can help affect it. Seasonal affective disorder, so for those of us who live in not sunny areas, in fact, if it's gray and raining or gray and snowing, or gray and miserable for a lot of the year, then we get seasonal affective disorder and it can lower the cortisol awakening response. Long exposure to fluorescent lights can be suppressive, as can suppressive medications such as opioids or steroids. And those steroids can be just like the steroid nasal spray that she's using. It can be like in joint injections. It can be the oral tablets. It could be inhalers. Anything that's steroidal can over time definitely suppress the HPA axis. So there's a lot that we have to look into as to what's suppressing somebody's cortisol awakening response. So when we look at her, when we go back with her worse fatigue because of the low CAR, she doesn't feel alert or switched on in the morning. She has increased risk of worsening her autoimmunity. She already has Hashimoto's and now she's feeling worse. And possible increase in future things. I've talked about blood sugar, inflammation, recall, memory issues, especially as she moves out of her 40s into menopausal years. And we already know brain fog can be a big issue there. And hormones are shifting there, and we know hormones have a big interplay with autoimmune. Understanding and improving her CAR right away is only going to help her case. So support options for her, focus on the basics, self-care, sleep quality, sleep hygiene, circadian rhythm optimization, meaning getting light in the morning, darkness at night, blood sugar regulation starting now, especially as her cortisol's not that great, and cortisol and glucose have that great interaction. Movement, hydration, community, these are the basics that just help with cortisol, helps with the HPA axis response. Remind her to use her sleep mask or to go back to her sleep doctor and get further evaluation if she feels like her sleep mask is not working. Address why she needs a steroid allergy nasal spray, because as I just said, steroids can be quite suppressive, especially over time to the HPA axis. And supplements to consider just to help give her the oomph, help to bolster her. So brain support, maybe something like Bacopa, adrenal and mitochondrial support. And when we work with the circadian rhythm and we work with the cortisol awakening response, we tend to give supplements for them on waking. Remember, she sort of goes down or flatlines. So we've got about 30 minutes where we want to make an impact. And so I'm going to suggest her brain support, her mitochondrial support to be given pretty much on waking if she can. I know not everybody can, especially with thyroid medication. Thyroid and a lot of supplements can interact with each other, but some people will do take their thyroid at night. Some people set their alarm and take their thyroid really early in the morning and go back to sleep. So kind of depends on the case. But in general, if you can have somebody take their supplements on waking, that can really help impact the cortisol awakening response. And then of course, sleep support at bed while she is working with her practitioner about her sleep apnea. So the purpose of this webinar, there's a whole lot more that goes into the cortisol awakening response. There's a whole lot more that goes into treatment, but I want you to understand the importance of cortisol and what it does, not only with, of course, everything else, but autoimmunity. And when you look at the Dutch Plus with your autoimmune patients, what's great is that we at Precision Analytical have a wide variety of resources to help you, one, interpret the test, and then two, understand what can you do with it? How can you support a healthy cortisol awakening response? And in addition, take all those hormones into play with your patient in adjusting for their long-term health outcome, reducing autoimmune, improving symptoms, improving energy and sleep, improving resilience, because that is what's really important. So in summary, autoimmunity is prevalent and unfortunately on the rise. And as we've talked about, the CAR plays a role in autoimmunity. It really helps that thymus gland pull aside and kill off any T cells that have failed central tolerance. By using the Dutch Plus, you get the Salivette swab, so you don't have to freely drool into a tube. You can just suck on a cotton swab and then put it back into the tube. Very convenient. We know that we always want to address the cause, of course, but in the process of addressing the cause, we will use cortisol signaling support so that we get the brain health, and we will use mitochondrial support so we get the production part. So from start to finish, you're really addressing your cortisol. And last but not least, my absolute favorite, utilize light and dark therapy to your advantage. It sets and corrects the rhythm for your daily clock, right? The clock that sets how you get up in the morning and how you go to bed at night. So use full spectrum light in the morning and make sure you're sleeping in complete darkness, winding down before bed. If you are new to the Dutch test, if you are new to Precision Analytical, we do have a special offer for you. You can sign up to be a provider today. And then when you do, you will get the offer to receive 50% off up to 5 testing kits. That does include the Dutch Plus, which we have been talking about. You can then take that information and get clinical consultation with one of our Dutch experts. And we do put you in our system so that when we have patients who call and say, I ran a Dutch test on my own and I'm looking for help, who would you refer me to? We can have you in our system and be able to send them to your clinic. If you're interested in getting started, definitely give us a call or feel free to email our sales@dutchtest.com. And that concludes our talk. I hope you feel much more versed and understanding in how cortisol plays a role in autoimmunity, how it affects the thymus gland, and makes you understand the importance of testing cortisol with your autoimmune patients moving forward. Thank you so much. Again, I am Dr. Carrie Jones, Medical Director for Precision Analytical, creators of the Dutch test. I appreciate your time.